hello, hello. Welcome, welcome. Have you been to our hospital before? Oh, no, that's okay. Not a problem at all. I'll just need to get some information if that's okay. For our system and everything. Yeah. Here, I'll go ahead and get this all down. I'm gonna go ahead and ask for your name to start. It's always a good place to start. Is that with one, two? Okay, one. Good. You never really know. Sometimes people spell a really regular name in a different way, and it just varies day by day. I really see a lot of people like that every day, as you can imagine. It just is what it is. Alright, and can I get your date of birth? Yeah, month, day, and year. Perfect, alright. Do you know your approximate height and weight? No? That's okay, we can figure that out later. I'll just go ahead and note that as unknown for right now. And don't feel bad. Honestly, most people don't. At least for their weight. Most people know their height. And usually, once you get to a certain height, you don't really grow anymore. But weight's not like that, so it's whatever. But that's okay. We'll go ahead and we will do both later, just for consistency's sake. Just so we have it in our system. Alright. Now, are you on any medications? Have you been on any medications recently? Or do you plan on being on any medications? Yeah, sure. Pretty much anything that you take consistently we would like to know about. Something even like a gummy vitamin, maybe? Do you take those at all? Or, I guess, really any vitamin? No, that's good. That's good. You should definitely be taking some sort of supplement for your bone health. It's very important and often overlooked. So, I'm very happy to hear that you're taking supplements for that. Perfect. Have you had any past injuries, or do you have any illnesses or conditions that we should know about? Alright, yeah. I suppose, while I'm at it, I should ask about any allergies as well? Yep, even the smallest things. Some people are allergic to shellfish and peanuts, and some people are allergic to latex. That's a really important one to tell me. A lot of our gloves are latex, so we have to make sure that you're safe and won't have a massive allergic reaction or anything. Alright, do you have any heart conditions? Okay. I know, it's such an odd question, but, I mean, there's a lot of heart conditions out there, and it can happen at any age, so we like to make sure. We want to make sure that every patient gets the absolute best care they can. So we want everyone to have a fair chance to get better, so... want to be very thorough with all of our information that we collect, of course. Of course, we take very diligent care of all of our patients here. It's really a labor of love to know that our patients are well taken care of and leave feeling better than they did coming in. Speaking of, why don't you let me know some of your symptoms? Oh, yeah, okay. My pencil is ready. Go ahead when you're ready. Okay. And how long has that been going on? Okay, yeah. Have you been keeping track on a calendar or in an app, or are you kind of just vaguely remembering? Either way is totally fine, mind you. But we want to make sure we are as accurate as possible. Alright. And, what else did you say? Huh. Yeah, no, absolutely worth noting, 100%. Oh, what's the paper you have? Oh, those are your symptoms that you're experiencing right now. I'm sorry, yes, have been experiencing. Okay, no, that's fine. I'm very happy to see that you've cataloged everything. That's just quite a bit. It's quite a bit. That's, quite a lot going on. Go ahead and read that list through for me if you can. Yeah. Of course, yes. Go ahead and write that down as well. Just for curiosity's sake, how many do you have more written down? Oh, okay. Well, then we'd better keep going. Sounds like you took some very in-depth notes, which we do very much appreciate. It's always nice to have a lot of information to go off of, so thank you for being so prepared. I'm sorry, can you say that one again? I don't think I heard you right. Oh, okay. That's interesting. Well, just earlier you said you were having, cold spells, and you just said you're having heat flashes. It's just an interesting combo. Carry on, carry on. Oh, okay. Wow. That's, it's not something we hear very often. So, thank you again for cataloging that. I'd like to say that it usually narrows things down a bit, the more symptoms you have, but, that doesn't seem to be the case with you. That's interesting. How many more do you have? Oh. Okay. Hmm. Of course, yeah, we'll still go through all of them. I'm just gonna go ahead and repeat all of the ones that you have told me thus far. Is that okay? I'd really just like to make sure that I have everything right. So, let's see. You've had headaches, dizziness, nausea, fainting spells, cold flashes, hot flashes, trouble sleeping, restlessness, excessive energy. Now, that's a fun one. Aching bones, tender skin, easily bruising, a stomach pain, heart pain, which that's, we're gonna mark that one as pretty urgent. Your eyes are irritated, your skin is irritated, your, oh, what was this one again? I see, okay, dry mouth, a tight throat, oh, interesting. That is something that we usually see with allergies, but you let me know that you are not allergic to anything. At least that you know of. We can go ahead and do an allergy panel for you. There's still more? Right. Okay. Interesting. Fainting, yes, I got the fainting one down. No worries. Itchiness. Now, we did say skin irritation. Is that different? Oh, okay. So the irritation is more of a burning sensation? Alright. So I guess I will note the itchiness separately. And we'll go right there. Sweaty hands. Okay. Alright. Is that normal for you? Some people do just produce a bit more sweat, but is this a consistent problem or something that's just recently started to show up? Okay. Interesting. Well, this is quite a lot of physical side effects. How are we doing upstairs, so to speak? Are you experiencing any sort of mental health troubles due to all of these symptoms? Duly noted. And how long has that been going on? Okay. Interesting. So, I'm going to be very honest here. This is quite the list of symptoms. I don't think I've ever had to turn the page to write down everything. That was everything, right? Of course not. Alright. Go ahead and continue. What else was there? Right. Okay. Interesting. You're saying your knees are weak and your arms are feeling heavy. Okay, well that could be some muscle soreness. Do you exercise excessively? Do any sort of excessive or out of the ordinary movements during your work or leisure time? No. Okay. Mhm. Okay. Well, is this the end? Oh, the wonderful, wonderful. I'm glad we could get all of that listed down and everything. I'm just gonna go ahead and look over this. Oh, do you smoke? Do you drink alcohol at all? Okay, I will go ahead and note that as well. What was that? Oh, you thought of something else. Okay, well, go on ahead. I'll write it down for you. Your feet keep getting bigger. Are you speaking about swelling? No, okay. Elaborate a bit more. I haven't quite heard that one. And how many times did you say you've had to buy new shoes? Okay. What was the starting shoe size? Huh. Alright, yeah, this is definitely a bit of a head scratcher, I won't lie. But that's okay. That's okay. I'm gonna go ahead and do some examining. And we'll do some tests and kind of see what we can figure out. See if anything has gotten worse, and see potentially what we can do to make you feel better, alright? Alright, forgive me. I'm gonna go ahead and put on some sterile gloves. Of course, safety and cleanliness is always our first priority. Alright. There we go. Alright, so I think we'll go ahead and start. Oh, where to start? Alright, here. I'll go ahead and just test your reflexes a little bit. We'll see. We'll check your knees really quick. You were saying you have having some knee pain, so let's go ahead and test that out. I'll just gently tap, and we will see what you're feeling, okay? 1, 2, 3. Okay. Here, do you mind just adjusting how you're sitting really quick? Stand up straight. Make sure your legs are a equal distance apart. Yes. Alright, ready? 1, 2, 3. Did you feel that? Oh. Nothing at all? No pain? No, oh, no, nothing. You didn't feel the contact on your skin? Well, let's explore that a little bit here. I'm gonna go ahead and just hold your knee. How about here? Are we feeling this here? No? Alright. I'm going to go ahead and move down to your calves. Go ahead and let me know if you feel anything. Nothing yet? No pressure? Okay. I'm gonna go ahead and check your arms just for that same reason. We'll see if you get any sort of sensations or anything, and we'll go from there. Ready? Just some light pressure, nothing crazy. Nothing that should be painful to you at all, but please let me know if it is. Oh, okay, you felt something there. Go ahead and describe that for me. Itchy. Alright. Well, I do have a treatment that I can apply just topically. Would you like to try that? Sure, yes. Here we go. I can go ahead and just... Here we go. I'm going to apply that. There we go. Alright, that should be alright. This is hypoallergenic. This is safe on 99.9% of skin, so this shouldn't cause you any sort of irritation or anything like that. I'm just going to go ahead and kind of rub that in, more like pat it in. I do prefer patting in ointments and lotions and serums. I do find it to be a bit more gentle and effective. There we go. That should help with the itching. But we will come back to that in a little bit after we let it settle in your skin and work, okay? I did notice that, yes, there is some areas on your skin that are a bit discolored. Seems like you were kind of itching there, so hopefully that will help, yes. So, the bruises are a bit different. Do you mind talking about those? Huh. Okay. Are you considered clumsy at all? Okay. Is there anything else that you would like to tell me? Okay. Okay. We will come back to that. We will come back to that. For now, I am curious to know about that scalp sensitivity that you mentioned. Do you mind describing that just a little bit? Okay. Okay, and does pressure affect it at all? Does it feel odd? There we go. Okay. Yeah, alright, so I will... I think I'm going to apply a separate serum, a completely different serum to your scalp, and hopefully that will address that feeling that you're having. Let me go ahead and... Now, where did I put that? Okay. Nope. There we are. Alright. So I'm just going to go ahead. I'm going to apply just a very modest amount to your scalp. It's a little liquidy, so pardon the strange feeling. Just go ahead and... There we are. No worries, no worries, I've got it. I won't let it drip anywhere. Here we go. Just a little more. Perfect, perfect, perfect. Now I'm gonna go ahead. There we are. Perfect, perfect. Wonderful. You are doing an excellent, excellent job. We're just kind of gently pushing that into your scalp. Letting that absorb. Oh, pardon me. Gloves are a little big. We are all out of size small, can you believe? But that is alright. I'll just be making sure that this is well absorbed. Kind of welcome it to your scalp. Okay, there we are. That should be alright. Now, I think one of the more concerning things that you mentioned was some of the things that had to do with your head from the neck up. So I'd like to explore some of those symptoms that you listed earlier. So I'd like to go ahead and visit some of those. One of them, you mentioned ringing in your ears. Is that right? Okay. And how often does that happen? Okay, not a problem. Is there anything that you've noticed that triggers the ringing effect? Huh. So it does just happen at random? That's okay. I'd actually like to perform a test, if you would allow. It is a bit experimental, but we've seen a lot of promise in this, so I would like to see if this works well for you. I'm going to be playing a sound at a specific frequency, and I'd like to see if this helps or hinders that effect. Absolutely, yes. So if you'd like, go ahead and close your eyes for me. This won't hurt at all, I promise. It's absolutely okay. There is no need to worry. There is actually nothing physical that will be touching you here. It is entirely sound-based, so you can be at ease. Alright, so I'm going to start over on this side, right here. There we go. And I'm going to just... There we go. And how did that feel? Alright, I'll go ahead and do that again for you, of course. Really? Alright, well, let's go ahead and test the other ear. And just for the sake of symmetry, I will go ahead and do that again. Now, how was that? It is a frequency-based treatment and test, kind of all in one. So, depending on whether or not that helped or hindered, I may try another. I will have to look for that other one. Oh goodness, where did I put it? Oh, if you don't mind, I think I actually left it in my drawer in the other half of the office. Allow me just a second. I'll be right back. Here we are. Perfect, perfect. Exactly where I thought it would be. Now, this one is going to sound a little bit different. So, I would like to go ahead and try that out this time. I will go ahead and start on this side, okay? I know that was a little loud. I apologize if that startled you. Yes, this one does linger a little bit longer. We'll go ahead and do that again though, no worries. There we go, that one was much more subtle. There we are. We're gonna let that fade out. And we'll go ahead and try on this side now. This side over here. There we go. Alright. One more, yes, I'll do one more. There we are. And again, if at any time any of these tests or treatments start to not feel good, feel a little unpleasant, or begin to hurt, please let me know. I will stop immediately. Now, I'd like you to go ahead and tell me how that felt. Are you feeling better or worse? Okay, that's incredible. That is incredible. It sounds like we have solved one of your issues, I think. Oh. And so it fixed that, but now your brain is itchy. Huh. That's a new one. I won't lie. Let's go ahead and see if that's perhaps just some of your inner ear that's been kind of rustled up from that sound test. Let me go ahead and just clean that out. And I'm also going to grab some samples while I'm in there. No biopsy or anything. We're just going to collect some of your, your inner ear stuff. There we go. Just going to swab gently. Kind of see if this helps the itching at all. Go ahead and let me know. And there we go, there we go. I'm going to kind of diligently go around and try to pick up any bit of sample that I could use. Alright, I'm just going to look in here. Kind of check. Okay. Interesting. Alright, I'll come back to that. Let me go ahead and do the same over on this side. Here we go. Just go ahead and turn your head for me. Yes, perfect. Once again, I'm going to try and collect a good amount of stuff to sample. I try not to embarrass patients by using too clinical of terms, so Pardon me for being a bit vague. There we go. Now, how does that itching feel? Are you feeling better? Are you feeling worse? Neutral? No change? Oh. Okay. Well, let me go ahead and try something else. Once again, a little bit experimental, but I would love to see how it affects some of these symptoms. I am really kind of boggled by some of these, truly. But it's a very interesting case I would like to crack. So, I'm going to go ahead and insert this here. There we go. How does that feel? And how is that? Okay. Let's go ahead and try that on the other side. There we go, there we go. Interesting, interesting. Alright, that's good to know. Now, I did also notice a bit of patchy skin around your neck. Would you mind if I take a look at that? Yes, of course, of course. Let me just go ahead. And I'm just going to kind of feel around. Let me know if there is any sort of discomfort or anything along those lines. Alright, and isn't there any pain or irritation as I do this? No? Okay. Do you wear any perfumes or colognes or scented lotions around your neck area, perhaps? Okay, so that very well may be the cause. There is often things, normal everyday things, that can cause some skin irritation. So I think I have just the thing to help with this. It is another cream that I will go ahead and wrap with some gauze for you so it can stay lightly pressured and kind of, tucked all in so it can better fix that area that we are looking at. I'm sorry, what? Oh. Okay, it's itchy? Okay. On a scale from 1 to 10, how itchy would you say? A 1 being very minor, a 3 or 4 being a mosquito bite, a 10, I guess, being cannot resist scratching. Itch it for you? I can't see that that is a standard, way of treating or testing. It's a 10? Oh, yeah, please don't itch it, actually. I'm so sorry. Alright, I will go ahead and itch that for you. Now, it shouldn't do anything crazy. Oh, my goodness. Your skin is incredibly rough. Does it normally feel this way? Okay. I'm gonna kind of move over to this side. Let me know if that changes at all. Okay, I'm gonna go ahead and no, okay, I'll go ahead and keep applying some light scratching motions for that. There we go. Alright, I will eventually have to stop scratching your skin for you. So I am, in the meantime, going to look for that cream so I can go ahead and apply it. I know, I'm so sorry. Please resist the urge to scratch. Let me just go ahead and get that gauze for you. Now I'm just going to go ahead and get a sterile gauze for you. And then I will have to measure out approximately how much of this I should use. There we go. I'll go ahead and put that there. We'll go ahead and unfold this. There we go. I know it's quite large, isn't it? But certainly need it. So let's see. I'm going to go ahead and just put this out here. Let's see how much of this. Okay, you do need quite a bit, but you do not need all of it. So I will trim it for you. Please do not scratch. Thank you. Now let me go ahead and find a scissor to cut this to length. I believe I left that in my other drawer. Silly me. Please don't scratch. Thank you. I will be right back, and I'll see if you scratch. I will. I saw that. I did see that. Alright, I did find my scissors. But, will I need to keep your hands to the desk? Will I need to adhere them? Okay, not a problem. There we go. There we go. Well, you did come to the ER, so you will hear some ambulance sounds every now and again. Unfortunately, that is how that is. Now, I'm going to go ahead and remeasure that, actually. So we need this over here. And then I do need to bring that kind of pull it dot. Alright, so there is about 3 inches of gauze I will be trimming off. Here we go. There we go. And no, you could use a bit more over here, so let's go ahead and take care of that. Yep, now go ahead and hold still. now that we have our gauze, I would like to go ahead and put that cream on it, that antibiotic. There we go. I do want to make sure this one is thoroughly filled with it, just saturated. There you are. Now let's go ahead and put this on to assure that that is adhered well enough to your neck. I would also ask that you do not do any excessive neck movements for the next 24 hours. Alright, there we are. Now, it seems we have solved a few things, at least, that you had listed. However, there is some things that are not my specialty, so I will have to pass you on to another doctor. May I write you a referral? Yeah. Right. There we go. Yes, I will need to send you to another doctor. I know that sounds a little disappointing, especially since a lot of these symptoms are quite serious. However, they are outside of my expertise, and I would hate to steer you wrong, so if you would be so kind, I would really love to schedule an emergency visit for another time. Yes. Not a problem. You will not have to wait for insurance approval as long as it is a referral from me. So, I will get that written up for you. Don't move your neck. Yeah, try and keep that nice and steady. I'm going to go ahead and put this over here. There we go. There we go. And there. Now, who is your provider? Oh, that's okay. We can work with that. That is a-okay. Now, this next doctor that I will be sending you to will be able to evaluate the other skin and bone and heart issues that you're having. So, please make sure to list all of those symptoms with that doctor, okay? Absolutely, she is wonderful, wonderful, wonderful. She actually specializes in some of the areas that you had mentioned, so I do believe she will really be able to help you. It does seem like her schedule isn't nearly as full as it could be, so I'm going to go ahead and I'm going to check to see when I can get that appointment in for you really quick. It also does help that you are in network with her, so let's go ahead. Okay. Alright, she is available next week. So I do hope you look forward to that. Make sure to give them a call if they do not call you first by tomorrow, and give them all of your information and everything so you'll have a very smooth process and appointment. Of course. That's excellent. I'm so happy I could help you with some of your ailments. Perhaps your next doctor will be able to help you with the other 30. I mean the other, a few that you've mentioned. Of course, yes. Well, it was lovely seeing you. I'm so happy I could help. I would like for you to go to the receptionist desk, and they will give you any of the paperwork that you need to sign, alright? Perfect. Well, you have a wonderful rest of your day. Make sure to rest well tonight. That antibiotic will make you feel much better, but healing is a process that can be pretty strenuous on the body, so make sure to be kind to yourself, alright? Get plenty of rest, drink lots of water, and try to have a smaller, more gentle meal. A soup or something would be perfect. Absolutely. Well, have a wonderful, wonderful rest of your day, alright? Thank you so much for coming in. Bye-bye.